So today we're here to celebrate 3 of the projects that have been funded by the Centre for Medical Engineering's Community Health Fund. So each project was awarded up to £5,000 to work with their local community or patient group and to do projects that really improved and increased the wellbeing among their population.
We're proud to have supported these organisations and projects through this fund. All of these organisations have used the fund to either create new programmes that cater to their community's health and wellbeing, or to expand existing programmes that cater to what the community is saying they need.
We support children and young people with heart conditions from birth to adulthood. And this encompasses the whole family. The resource aims to help families fulfil their life needs, whether that be cultural, religious, dietary, wellbeing or activities, to take time away from the hospital bedside and reach out for support when needed.
This is a project that we've called Our Diverse Neighbourhood, and it's a mapping tool that can be used by families when their child is staying in the Evelina Children's Hospital. It maps community assets in Lambeth and Southwark. They may have come into hospital in an emergency situation with nothing.
My passion comes from the heart, really, and I have the pleasure with the team to support the families on the wards every day that I'm at work. These families arrived anxious, they're worried, they're fearful, and we can try and help make that better. But this resource that has been created hopefully will now lighten that load.
And by hiring a photographer with expertise in social settings, weddings and so on, then you get a much friendlier, warmer, kind of accessible shots. Joel went above and beyond what the brief was.
To be able to do the project and to put myself back to square one and imagine that I didn't speak the language, I didn't know where my favourite restaurant was, I didn't know how to get anywhere, I had no friends, and I'm in a tricky situation. And it's hard to do if you're in your comfort zone.
We're trying to capture that and bring Lambeth and Southwark to the bedside.
We are a charity that's 20 years old, and we were founded in order to provide access for children living in the city to green space. And we started out just by taking children out into the countryside, and over time we have changed to include our own spaces, which is really lovely. This is why working with King's has been, for myself and my colleagues, particularly important due to the research that they do with health. As a gardener myself, I'm lucky to understand the link between health and the outdoors, and health as an ecosystem rather than a list of parts. And I'm very happy to have worked with Deanne, who I know also shares this understanding and desire to bridge the gap between the many approaches King's and the Paper Garden has.
It was a year-long cooking and growing in the garden project on Saturdays, alternating Saturdays, 20 workshops or so, which took place at the Paper Garden in Surrey Quays, where we invited members of the community to come and grow food with us and use that food in cooking recipes from across the world, led by our community chefs. We work with a large proportion of people who don't have access to green space. Giving people the opportunity to access nature is always at the core of our work. It feels like a sort of extended universe of King's College and the Paper Garden, and just a deepening of a really beautiful relationship that we have already.
Inspire Walworth is a neighbourhood charity that runs community services and programmes, including the development of young people from the borough. With the grant, they developed and delivered a community research project about attitudes towards healthy eating in 16 to 24-year-olds. With the skills learned by the young creatives to film and conduct interviews, the film will be used as a tool for health researchers and other community members. They hope to continue working with healthcare researchers to share the link between local dietary habits and different health conditions, so there can be more useful conversations between scientists and people living locally around healthy eating. We worked with our local community members to not only shape the fund, but also they helped us to select the projects that went forward. And this is just one of the ways in which we work with local communities to encourage and improve the engagement they have with our staff and our researchers and our knowledge.